Tamika Mosley, better known as Sickle Cell Natural Healing, and also project manager for Healing Blends Global. And today I want to address some questions. I'm a part of this WhatsApp group, and I have some questions from people coming out of Africa. So I want to go ahead and get started to address a few of these questions. The first question is someone in Zambia asks, has anyone had experience with leg ulcers and does Even Flow help? So it's going to depend on the stage of the leg ulcer. If you are in the beginning stages and it's not that bad, well, then of course you can take, if you're an adult, you can take 5 to 6 even flows a day, but you also want to take vitamin C. So I would say about 20,000 milligrams of vitamin C twice a day. So that's a total of 40,000 milligrams of vitamin C. Now, C is water soluble, so it's going to go right through you. So it's perfectly safe to take vitamin C in large doses. Now, it does cause loose stool. So if you're noticing that you are having diarrhea-like symptoms, and that's because of the vitamin C. And at that point, you can actually try something different, such as curcumin. And actually, you may want to go ahead and do curcumin as well. And I say curcumin because it is much powerful, stronger than turmeric. Curcumin is the main ingredient in turmeric, and curcumin has just been known to be just amazing anti-inflammatory. If it's a really bad ulcer, and if it's an open wound, if you see blood or things like that, well, then you want to incorporate other things. You want to do things, continue doing the even flows. You can do 3 or 4 even flows a day. You can also do the curcumin. You can do garlic. Garlic is natural antibiotics. You want to make sure that it doesn't get infected. And also keep doing the large dose of vitamin C as well. Now you can also make a paste out of coconut oil and curcumin or turmeric powder. And you can put this paste on the actual wound itself and then put a bandage over it. And you want to do this maybe 2 or 3 times a day. Now it gets pretty messy, but it will start to heal faster with that curcumin directly on the wound itself. So these are just some things that you can do. Aloe vera gel is also great as well, but these are some things that you want to do to actually start healing it. If it's really, really bad, you want to make sure you take a lot more of natural antibiotics, and vitamin C, oregano, garlic, vitamin C, all these things are natural antibiotics. Okay, now Tanzania, someone asks, a child on Even Flow and does not have access to natural antibiotics to prevent malaria and other infections, and they are prescribed antibiotics. How do we use this together with Even Flow? Okay, so Even Flow is just food, okay? So perfectly safe to take with other medications. The thing that we say is you want to take it 2 hours apart. So if your child wake up in the morning, they take Even Flow, within 2 hours later, you can give them their prescribed medication. Or if they wake up and take their prescribed medication, then 2 hours later, just give the Even Flow. So really no big deal. If you want to wait 1 hour, 2 hours, it's perfectly fine, perfectly okay. You can definitely take it with other medications. Just not all at once. Don't take it all together. Okay, this is the East Africa WhatsApp group. How long has your child gone without a crisis? And Aiden has, of course, everyone know he started out at the age of 1 having crises every 2 to 3 months. We were in the hospital. But since starting the natural route, he has not had a crisis in 8 years. Now, during these 8 years, I too had to learn, as you all are learning, how to give Even Flow. I was not educated on how to give it. Back then, it was the old ingredients of Even Flow that we had, where a child had to take 2 and 3 supplements a couple times a day. So when Aiden would go out camping or doing stuff, I didn't know that I need to be giving him more Even Flow to prevent a crisis. At that time, I would just still give him his maintenance dose. So in those 8 years, he had 2 beginning stages of crises, meaning he came to me and told me that my hand hurt. And I immediately started giving 1 Even Flow capsule every single hour. And then the crises just went away. And that's one thing to understand, that if your child is going is in the beginning stages of a crisis, as soon as your child tell you that I'm hurting, immediately start one capsule of Even Flo every single hour. The sooner you start it, the faster the crises will get over. But if you wait until a child is in level 10 pain, then it's going to take anywhere between 1 to a day and a half, possibly 2 days, to get totally out of the crises, because it has to have time to start working, the body producing red blood cells and pushing those stuck cells on through. The second time, I think Aiden was in the beginning stages of a crisis. I'm not sure what was going on. Maybe he was playing sports or doing something, and he actually didn't tell me that he was hurting. And he waited until he was level 10 pain. And then that's when I started the one capsule every hour, 10 p.m. at night. And actually by 7 o'clock the next morning, he was out of the pain crises. But when I tell people, honestly, he has not been hospitalized in 8 years. What became of the Kenya study? So, good news on that. The hurricane in Florida caused a huge delay of things, but the Even Flo was shipped out a couple weeks ago. The product is actually in London at customs. So as soon as that clears, hopefully they will clear it through this week, and will go ahead and be shipped over to Kisumu to Dr. Muga. So that is en route now. And Dr. Ware is going to be shipping the test kits for the hemoglobin and check, people for the sickle cell. He's going to be shipping that out this week, and this time we're going to actually use Kintex, our own courier that actually delivers directly into Kenya. So it's on its way. The product is on its way, and hopefully we'll get this study started. So I'm going to keep you guys updated on that process of the study in Kenya with Even Flo. And lastly, any herb to help typhoid. Now, typhoid, from what I've seen, is a bacterial infection that comes from contaminated food and water. Again, you get fevers, weakness, stomach pains, headache, loss of appetite. So anytime we're talking about an infection, dealing with an infection, Malcare is going to be extremely great for that. Again, also natural antibiotics. So garlic, even ginger capsules, oregano, and lemons. Lemons help alkalize the gastrointestinal tract. So you can give any of these. Anytime I help my child, I always like to do 2 or 3 different things. So I would say the Malcare, you can give it 7 times a day. The garlic capsules, you can give 1 garlic capsule every hour up to 6 hours. Oregano capsule, you can give 1 of those every hour up to 6 hours again. So the faster immediately that we start help treating the symptoms with these natural antibiotics, the quicker they'll get over these symptoms. So all these natural antibiotics, they can actually kill the infection on the spot. Just have to give more of it. Again, it's just food, so it's okay to take more of it. And that was actually all the questions that we had so far. And I know there's a lot of questions going around about Even Flo and how do I take it, how do I administer it. And I just want to kind of reiterate, if you have an infant, 4-month-old, 5-month-old, 6-month-old, definitely get the liquid for them. The directions should be on the bottle. In case they're not, for infants, you want to give a half a dropper per day, and the liquid comes with a little dropper. So you just fill the dropper up and give them a half a dropper per day. If you have a toddler child, ages 2 through 10, who's taking liquid, you want to give them 1 full dropper of the liquid twice a day. Now, capsules for toddlers, and when I say toddlers, I mean ages like 1 up to like 11 or 12 years old. They only need 1 capsule daily for maintenance. Okay, again, if they are going into a crisis, you want to do 1 capsule every hour. And you can do this up to 15 capsules, okay? It's just food, it's okay. But the more you keep giving, the more it's going to help the body produce red blood cells, the more it's going to push those stuck cells on through, and the crisis over with. And the same with the liquid. If you have the liquid, you want to give 1 full dropper every hour. So that is all I had for now. And again, let me know if you all have any more questions. Just leave your questions in the WhatsApp group, and I will answer them as soon as I can. So thank you, and talk to you guys soon.